Welcome, everybody. So what is prolotherapy and an introduction to regenerative injection therapies? I'm Dr. Jen. I'm a licensed naturopathic doctor in Nashua, New Hampshire. I have a naturopathic medical clinic here. And one of my specialties, my primary specialty, is comprehensive pain management. And I use a lot of techniques that most doctors aren't really well versed in. So I'm going to go through a few of those today. The things that I want to cover primarily are the prolotherapy injections, prolozone injections. I'm going to talk a little bit about platelet-rich plasma, and I'll talk a little bit about stem cell or exosome therapy. I'm going to mention other things that I do as well. When I take somebody in for pain, whether it's more an acute injury and it's someone like a high performing athlete. I work on a lot of hockey players, for example. So someone might want to be a little bit more proactive about making a complete recovery. And sometimes there's been a toothache in a joint for a lot of years and things are more chronic. And the injury, if there ever was one, was very old. So several reasons that people can come in with pain. When there's not a history of trauma and we're seeing a joint that needs help, it's usually something like progressive osteoarthritis or something more aggressive, like an inflammatory arthritis. When we have degenerative joints for whatever reason, whether that happened because of past trauma or that's just a degenerative process that hasn't been reversed and the joint is suffering and you're feeling pain and we can see it by taking x-rays. Usually the things that are done are going to be your standard non-steroidal anti-inflammatories, physical therapy series, and come back for a cortisone shot if the pain isn't well controlled with those things, or control the pain with the shot from the beginning if someone's in a lot of pain. More recent research is limiting the cortisone injections more and more. So fewer doctors like to do them. All doctors are starting to pick up on the fact that we're not doing really good things for our joints. We're actually creating more likelihood that someone will need a joint replacement down the line. And as a naturopath, I use very little steroid. And one of the reasons is when you put steroids into a joint, you do cause some necrosis, you cause some damage, you cause breakdown. So if you do that, especially over and over again, even if it's over time and spread out, you're not rebuilding the joint. You're actually doing the opposite. You're doing some damage. So the first thing that I like to do is figure out, okay, what's going on here? And if there's something like osteoarthritis going on, we have to put a plan in place to reverse the osteoarthritis. That's most often going to be an omega deficiency of some kind. So we look at fat intake and what's going on with diet and things like that. I have supplements that I recommend. The dosing of the fish oil that I use, for example, is higher dose than what you'll find in most products per capsule. And you get a really nice therapeutic EPA, DHA, and I'll also use some GLA, which is gamma linoleic acid or borage oil. It's a lesser known omega. At any rate, those work very well on inflammation. If it's more of a inflammatory arthritis, I work with the same fish oil, but the dosing is quite different. And what we're trying to do with that is usually quite different. Other things that I'll do to support a joint while I'm going through any kind of repair process are products that contain lysine, proline, and vitamin C. And why? In joints where there's articular cartilage, that's what the body needs to lay down cartilage and repair and rebuild. So among other nutrients that are really important for that anabolic process of rebuilding, the like ligament restore complex that I use has those things in it. My injections themselves. So let's start there. There's other things that we'll talk about that I do that are hands-on therapies that complement the injections really well. But today I wanted to focus a bit on the injections, and then we'll see how much time we have. So regenerative injection therapy using prolotherapy techniques with the addition of ozone, platelets, and stem cells or exosomes can actually help someone make a more complete recovery from pain and injury. All pain and chronic disease in the body comes from an increase in free radicals that stop the body's ability to use oxygen at the level of the cell, which depletes the cell of energy. And that low energy or low voltage in the cells is felt as pain. Usually that dull, achy pain that occurs daily and doesn't go away, even when you do all the right things like your physical therapy and rest and ice and non-steroidals and the things that are traditionally recommended. Prolotherapy is a non-surgical proliferation therapy, and it stimulates a really natural healing process to reverse the decline and the degeneration that we usually see as joints that are hurting age. It's also called regenerative injection therapy. And it's the prolotherapy because it's a medical technique that's used for ligament, tendon, and cartilage reconstruction. So people don't always realize that we can do that, but that can be done. You just have to use the right kind of instigating solution to engage with that mechanism. Prolozone, a little different than prolotherapy, is a prolotherapy. So I still do the same prolotherapy solution, which I'll talk about in a minute here. And what I do is I add ozone. The ozone therapy helps to restore proper oxygen utilization, so the sites of chronic pain can actually heal. So that method of addressing the underlying cause of the joint pain and injury provides more lasting relief by stimulating the body's innate repair mechanisms. The solutions injected are known as growth stimulants and activate fibroblasts through activation of the healing cascade and actually cause irritation at the tissues targeted by the injection. So whether I'm doing prolotherapy or prolozone, the first part of the injection is actually meant to irritate. It's meant to kind of poke at that problem a little bit. And I often explain it like we're creating a controlled injury. And we're doing that on purpose to engage with the body's natural processes for healing. It's not going to be a big, hot, swollen joint like when there's a trauma to a joint and we're having an unproductive inflammatory response that's over engaged. This very gentle irritation is just enough to get the body working on the area and just to kind of shine that flashlight into that joint and say, hey, we've got some work to do here. So how do I irritate the joint in just the right way to do that? I do use a local anesthesia, so usually a procaine or a lidocaine. I'll use a dextrose, which is a sugar solution, and I bring it to just the right concentration to instigate that response that we're looking for. And that's usually going to be a 12 to 18% dextrose. The other things I'll add to that first syringe are B12 and other nice nutritive things that just complement the injection. And that's just there. So when we start to do a little repair, we have some of what we need nearby. That's also being delivered through good blood flow and things like that. So my before and after care is really important. And I'm very, very picky about how people use things like ice and what people use for any pain that they're in. With the injections, as I mentioned, we're really trying to instigate an inflammatory reaction, again, on purpose, and one that's controlled. And we don't want to negate the effect of your injection by having you go home and then take like an Aleve or a Motrin or a non-steroidal anti-inflammatory, not even an aspirin. The only thing that if you have to take something for pain that we like you to take is a Tylenol. And I have other things that I prefer people to use so we don't have to take a Tylenol. I have some wonderful natural remedies and solutions that I use for pain that are homeopathic and do not interfere with that positive response that we created on purpose to get your body to work on repairing the joint. So that's prolotherapy, prolozone. With the prolozone, after I deliver that first syringe with the anesthesia, the dextrose, and the nutrients, usually at least a B12, then we're going to do an ozone gas. And the ozone gas can go right under the skin. It can go right into the joint. I can put it anywhere but a vessel. There is a way that we do it IV. That's a blood treatment I'll talk about in a different part of this series. And in joints and in pain conditions, the ozone therapy is just wonderful. So I'll be talking about that in relation to all kinds of conditions in the future. But for joint repair, I see people do phenomenally better when we use the ozone. So I always add the ozone if people don't have any reason that they don't want me to, that I shouldn't do that. Prolotherapy, just to go back and revisit a few things. When I'm thinking about regenerative injections for someone, I really have to think about where they're at in their kind of process. If someone's already had reconstruction surgery, for example, you're not even going to be a candidate for these injections. There are a few injections that we can do, but we can't go down into the joint. So the things that are available are going to be very superficial. Things like mesotherapy, things like neuroprolo, that might be possible for you after you've had some surgery done. But once you've had something replaced and they've put parts inside that don't belong to you, we really can't inject that area. There's too much of a risk for infection, and any injection therapist should say that. Once a joint has been replaced or there's parts that are permanent that have been installed, we don't go near that area with an injection, especially an injection that carries a sugar solution. I also want to address, I get this question a lot. I told you I put some sugar in the injection at a 12 to 18%. That's not going to be enough of a sugar load that I even have to worry about it with a diabetic on insulin. They don't have to make any kind of an adjustment. So you're not getting a big sugar exposure. I know, of course, we're all, most of us that take good care of ourselves and invest daily in our diet don't do a ton of sugar for that reason, right? It can be very inflammatory. But here we're using it strategically, and just to know we don't have to make any adjustments if you don't handle sugar well. The other thing that I do a lot with the prolotherapy and then the ozone is we want to get a little bit more out of our injections. I work on some pretty tough shoulders. I work with a lot of veterans that have really beat up joints. There are certain joints I'm not as negotiable with, like hips. I really, really like to do something called platelet-rich plasma when I repair a hip or when I'm dealing with hip pain that needs to be addressed with an injection. It's just so much more successful. Knees and backs, I can get away without the platelets depending on kind of the level of degeneration and the level of pathology that we're dealing with. But when I do add platelets, even to the knees and the back, people need fewer injections. So there is, of course, an increase in the investment that's required when we pull platelets. But for the investment, it's makes a huge difference in the number of injections that you need, the speed of recovery, and kind of the completeness of the recovery, how fully we're able to address that pain. So that's kind of the things we do the most of right now. I do a lot of prolozone, prolotherapy, and PRP. And with the platelets, I do those right in office. So we take a blood draw when you first come in, spin down that blood, concentrate the platelets, and it's just another syringe that we use when we're doing the injection. So we still do the prolotherapy syringe, we still add the ozone gas, and then we add the platelets. And it's wildly successful at even joints that people think there's nothing anybody can do. And even your orthopedic will tell you there's nothing we can do. You're on a watch and wait till surgery, and you're just trying to manage pain in different ways. To me, this is a really big problem in healthcare right now, that we're not having a conversation with that patient about regenerative injection therapies, even in a standard office. Even if even if we're not doing these injections because, under insurance, it's not considered medically necessary, there's enough evidence that we have great success with them, that to me, the conversation is one that should be had, especially if we're thinking about surgery and we're going to do something that will affect this person's ability to try an injection as a more complete solution. I see people all the time that get their joints replaced or do more standard treatments and, cortisone injections, things like that, and they don't have very good results. And once you've done too many cortisone injections, or you have an implant, or you've had a reconstruction, it's really much harder. And often you're not a candidate anymore for several of these injections. So to me, when a joint is continuing to tell us that it needs some help, and it does not resolving, even with all the good things you're doing for yourself in your own self-investment, your physical therapy, you're working with your doctors on this. If it's not getting better before you consider surgery, really good idea to talk to a regenerative injection therapist. I do also put stem cells into joints. However, the platelets work really well. So sometimes people prefer stem cells, and I love doing them. That's fine. But we can get really good results with the platelets. The platelets act like growth factors. And if there are good stem cells around, the platelets will activate those. So all of the injections that I do work better when we treat comprehensively. So some of the other things that I tend to integrate into a recovery plan, if someone is low in testosterone, they're not going to recover well from pain. So checking hormones can be really critical. If someone is a smoker and they are not getting oxygen in delivery to the cells, and there's reasons that that's happening, we sometimes have to make lifestyle changes in order to get a really good result. If someone is not getting regular massage, not doing foam rolling that's successful at keeping the areas open that are affecting the area in trouble, then I don't see people recover the same way. So I always do an assessment for those things and make sure that the soft tissues are being addressed as well. And I do a lot of hands-on work for a doctor. I do manual therapy. I do medical deep tissue, and I work a lot on opening up the accessory muscles that allow that good blood flow through an area. Through the back and the hips, for example, a lot of people will take care of their own hamstrings and their own IT bands with a good foam rolling session and stretching and all kinds of things, but not a lot of people take care of the quads the same way. So we might stretch the quads, but I often have to teach people to do really good foam rolling on the front of their lower legs. And it's just always a surprise, a wonderful surprise, how positively that affects a person's hip and back and knee pain when that hasn't been addressed. Even when someone's had really good PT, really good massage, really good ortho, really good neuro workup, I find that there are things that we do with the comprehensive pain management that are quite different, and our patients get different results even when they've failed in other offices for that reason. So again, I address things very comprehensively to get a better result. I hope that was a good introduction to the injections. I can talk a little bit more on any of these topics and then accessory questions if that comes up. I see there are at least somebody on. Anyone have any questions at this point? Alexa, if you had any questions, I'm happy to address that now. Sorry. There's my Alexa in my office. All right. Well, I'm answer from an Alexa Answers contributor that
I'm good, thank you though.
Okay, good. I have to let my Alexa calm down now. She's all
that happens.
It's hysterical. Did you get to hear a lot of the talk, Alexa?
Yeah, I missed.
Yeah, there's just something about doing the front of the quads that makes an unbelievable difference for back pain. It just opens things up. And there's always a really tight spots in there that people don't realize can be worked out. So it'll be very painful at first, and that's normal. And with the deep tissue session, I really try and identify where those painful spots are, so people know where the foam roller needs to go. And then I give the homework of doing the foam rolling. And I usually say, spend about 20 seconds in one of those painful spots and then go to another one. And even a few minutes a day makes a difference. But for people that have a lot of pain and really want out of it and will do self-investment at home, you can spend a half hour on each leg and just put a nice podcast on, and do that a couple of times in the first week or two. And I always know when people have done their homework, because they'll come back and it will be completely transformed. And it always affects the function of the hip and the backs in a very positive way, even when someone's been to a lot of people for help with that stuff. So,
yeah, that's awesome, and actually really good timing, because I don't often get hip pains, but I do today. I have just some tightness in my left hip, so that's definitely going to be something I'm incorporating for sure.
Yeah. And, work around the whole leg, but it's the first thing I'll do is address that lower leg. So the next most ignored spot is going to be the inside, like the adductor, the inside of the upper leg.
Interesting.
Yeah, but start with the top and then you can go to that middle. And then the other spot that people can do that helps so much is the gastroc, like the back of the lower leg. So when people have back or hip, again, it's usually going to be front of the upper leg with the foam roller and back of the lower leg. And for that one, I just sit on the floor and I cross my leg over. So if I'm doing my left calf, my right ankle will be sitting on top of my left ankle to add weight. And then I just pick myself right up off the floor. So I get my good planking and ab workout in while I'm doing my foam rolling.
Right, for sure.
Yeah. Yeah. And just be careful not to dump into the shoulders when you do that, or you'll end up with other problems. But, taking good care that way. Yeah. Yeah.
Yeah. No, that's great. Thank you.
Yeah. 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 And if you missed the beginning of the talk, and just for everybody, because I'm finishing the recording here, I'm happy to answer questions about any of the injections. I tried to go through some of the main things that I do that are just a little bit different in addressing pain more comprehensively. And it's one of my favorite topics to speak on. And I'm happy to get into this again, where there aren't a lot of doctors having this conversation when someone's not recovering from pain and the options are limited in other offices. Usually in my office, we're just getting started. So thanks for joining. And I'll get this posted, and please feel free to post comments and questions, and I will respond.
Awesome. Thank you.
Yeah, thanks so much.